Herbs are friends of physicians and pride of cooks. Good morning, honorable judges, fellow competitors, and all respectful audience. Today, I proudly present to you how to find RA, improving quality of life. We sincerely present to you our systematic review and meta-analysis entitled Efficacy of Indonesia Herbal Medicine as an Adjuvant in Rheumatoid Arthritis Management, a systematic review and meta-analysis of randomized control trial. Rheumatoid arthritis is a systemic autoimmune disease, a chronic inflammatory disorder. 71 out of 100,000 people are diagnosed with RA, with women 2 to 3 times more likely to develop RA than men. In Indonesia alone, the prevalence of RA based on a doctor's diagnosis is 7.3%. Although RA is associated with inflammation and pain, the exact cause of RA remains uncertain, and there is no treatment for its fundamental causes. The major goal of arthritis treatment is to reduce joint pain induced by inflammation in the joints, daily wear and tear of joints, and muscle strains. However, their long-term use cannot be sustained due to inadequate pain relief, immune disturbance, and serious gastrointestinal and cardiovascular adverse effects. Therefore, herbal therapies with anti-inflammatory properties and minimum side effects are needed for the treatment of RA, especially after the withdrawal of many Food and Drug Administration approved anti-inflammatory drugs. Currently, no systematic review and meta-analysis that discuss the efficacy of Indonesia herbal plants. After making this meta-analysis paper, we hope that Indonesia herbal medicine can be a consideration in overcoming RA problems, which will later become a national and international treatment strategy. Moving on to the methods, our systematic review and meta-analysis were based on search strategy using 5 mentioned databases. We include studies in our meta-analysis based on this inclusion and exclusion criteria. We include a final 10 studies in a qualitative and quantitative analysis. For more information regarding our methods, you can scan the barcode at the screen. We extract study data following order and year, study characteristic, study population, intervention including the dosage and frequency, and outcome in terms of Indonesia herbal medicine in reducing RA symptoms. Studies was also assessed in terms of its quality using Cochrane risk of bias 2.0 for RCT. Here is our study characteristic and outcome. In our systematic review and meta-analysis, we include a total 10 RCTs with a total of 584 patients from 4 countries as shown in this slide. Intervention assessed was Indonesia herbal medicine with on count, DAS28 score, tender joint count, swelling joint count, ISR, CRP, visual analog scale, and rheumatoid factor. Our meta-analysis depicts the efficacy of Indonesia herbal medicine for rheumatoid arthritis using forest plot. It shows that Indonesia herbal medicine significantly decreased DAS28 score with MD minus 1.01, tender joint count with MD minus 5.07, swollen joint count with MD minus 4.33, and erythrocyte sedimentation rate with MD minus 44.556. The next meta-analysis also show reduce in C-reactive protein with MD minus 0.39, rheumatoid factor with MD minus 51.32, visual analog scale with MD minus 4.54, and adverse effects are not significantly different from the control. Surprisingly, heterogeneity was not found on rheumatoid factor and side effect. This is the first systematic review and meta-analysis to assess the efficacy of Indonesia herbal medicine on RA management. With its various roles and abundant availability, our study shows that herbal medicine decreased DAS28, ISR, CRP, FAST, RF, tender joint count, and swollen joint count significantly with P less than 0.05 for all instruments. Our meta-analysis has good results in the study conclusions, minimum side effect, and significant result in the overall instruments. As for the strength, our study has variation in RCT locations in different countries, significant result for all outcomes and many studies. While for limitation, we were only extracting data from published paper in English, and heterogeneity is quite high in some outcomes. In terms of safety, Nugraha et al. Also state that there are no adverse effects of using Indonesia herbal medicine. As a recommendation, we recommend that more FCTs on each herb, followed by determining the effective dose and frequency for each type through secondary review and making guidelines and socialization to the community. In conclusion, clinical symptoms of patients with RA with the intervention of Indonesia herbal medicine can significantly reduce clinical symptoms and side effects. With routine healthcare services, the quality of life will improve. Thank you. That's all from me. Indonesia herbal medicines for RA better features.